My name is Kamran Parsa. I'm a board-certified neurosurgeon practicing here in the Antelope Valley, Palmdale Regional Medical Center. I am Vice Chair of Surgery here at Palmdale, and I also serve as the Director of the Stroke Program. So when we say stroke in general terms, stroke occurs when you don't have that blood or nutrients going to those cells, and the cells starve to death. Your brain obviously is valuable, it's a valuable real estate, and some areas are more valuable than others. But the more area stroke covers, the more it's going to affect. You can have a small stroke in your midbrain, your pons, where you have a lot of critical nuclei that function and tracts, or neurological tracts. But if you have a small stroke in your prefrontal cortex that may have some executive function, but it's not going to dramatically affect your quality of life. You would have a stroke of a specific artery or a branch of the specific artery called the middle cerebral artery. The reason that strokes the most is because the highest flow is to this area. This area is essentially your daily functioning of walking, talking. So obviously, since that's part of your brain's constantly functioning, it has a high volume. And if anything's wrong in your heart or in your neck, where the stroke usually starts, you would have that area affected the most. Well, if you have a stroke on the right side of your brain, it would affect the left side. So other less obvious causes or presentation of stroke would be dizziness, headaches, nausea, a little bit of imbalance, not walking properly, to name a few. Key ones are the slurring of speech, the weakness in one side of your arm or leg. Usually it's not bilateral. Obviously, you've done your part, called 911. That's the most important part. And at the stroke center, they would obtain imaging right away to confirm the stroke. And they would start different medications depending on the time frame. So there are specific protocols of how to treat stroke depending on how quickly you present. So the initial one may be a very strong blood clotting agent that is injected into your circulatory system that would go to your brain and break these ischemic clots. That's the initial, the most common. Now, in certain scenarios where you pass that time frame, or if that blood clotting agent did not work, you may need a loved one transport to a comprehensive stroke center where they would do more interventional treatments, which would include a catheterization up to the brain to actually retrieve the blood clot. Those are the standards. This is all ischemic stroke, which is about 80 to 90% of all strokes. Hemorrhagic, so yes, it's about 10 to 20% of all strokes are hemorrhagic. And if it's a large hemorrhagic stroke, then that may involve my services mostly as a neurosurgeon, where I may have to go in and take the blood clot out of the brain and place different types of drains to maintain the pressure of the brain. So the interventions can be much more serious with hemorrhagic strokes, but thankfully they are much less common. Ischemic strokes are more so and have less invasive treatments. Factors. So number one factor is age. If your loved one's 95 years old and frail and they have a poorer outcome. But if it's a 35-year-old who unfortunately had a hemorrhagic stroke for one reason or another, you have a better outcome. Just age alone is one of the strongest factors in outcomes for neurosurgery. Other than that would be the volume. We discussed the amount of stroke and the location. So if you have a location in a bad area, no matter what I do, I may be able to save a person's life, which a lot of times we can, but most importantly is what would your loved one or family member want for their life? Would they want to be paralyzed or unable to talk or be in quote-unquote a vegetative state? It's important that as family members to have these discussions with your loved ones, as hard as it is, because it can happen, but I always have the discussion. What would your loved one want? I can save their life, but am I going to really improve their function? Don't worry about the time. Just rush as soon as you know. Don't wait, rush as fast as you can. And from a clinical perspective, there are timelines. So there's the 4-hour time frame where beyond 4 hours, we won't give that blood clotting agent. You don't qualify anymore, then we have to do other things. Hemorrhagic stroke is very different. It's doesn't really have a timeline, it's every second. So get in because if this blood is expanding, the hemorrhage, even though you need the nutrients of the blood in your vasculature going to your cells, but if it hemorrhages out of those vessels and goes onto the brain parenchyma itself, it acts like acid. It's literally killing your brain cells constantly until it forms what we call a clot. So when it forms a clot, then it's just a mass effect and it's pushing on the brain. Your brain is in an enclosed space and it doesn't like to be pushed around. It's going to herniate. You will lose your life. Once the brain realizes there's mass on it, then it starts to swell. So when it swells, then things stop to work and it starts to pressure more structures. So it's a very different, hemorrhagic stroke is completely different. There's a form of stroke called a TIA, or transient ischemic stroke, where your loved one may develop or say, oh, my arm feels funny, or they may have a facial droop for an hour or two, and you're rushing them to the ER. By the time they get to the ER, they're normal. So these are ischemic strokes, TIA, transient ischemic. They go away, but they're sort of a warning sign. That means, okay, you were lucky this time, but make sure you follow up with your cardiologist, your neurologist, and make sure that you get the appropriate workup outside of the ER with your family member, because it means that you can have another one within 30 days. You have a high chance of having another one within 30 days. So that's one type. Or the other types of strokes are very common, which never even present, and some people say it's dementia as you're aging, but really it's these small micro stroke in an area called the white matter of your brain, and they don't really cause any symptoms. Your body is able to acclimate and create new tracts over time. So many occur over time that you start to have memory deficits and slowing of your brain function. One other type of stroke. And then also location. Lastly, if you do have a hemorrhagic or ischemic stroke in the distal prefrontal area, which is again a cognitive part of your brain which forms your personality, you may lose part of your patience. So if you're a very patient person and your loved ones may notice that, hey, you've lost a little bit of your normal patience. You're not as calm as before. So you can have strokes that come out as normal per se. So it's a cliche, eat well, live well. You've heard enough of it that you may not want to hear it anymore, but it's true. So in young individuals, they occur, whether it's genetic. So if it's genetic, you can't do anything about it. If you're young and you're using cocaine or these amphetamines, these increase blood pressure. So your brain, you have your aorta, which from your heart it goes to your aorta and eventually goes up to your brain. But the aorta is a big, thick vessel with lots of muscle. But as they go up and make their way to the brain, they become really tiny, tiny nano vessels. These are small vessels which don't have a strong muscle surrounding it. So what happens is, when you have a surge of a blood pressure going up, such as with amphetamine use, these vessels can't accommodate for this surge of blood and they burst and you have hemorrhage. So that's usually the most common cause of young individuals I've seen with stroke, which turn out to be hemorrhagic stroke. As you age beyond 40, it becomes more of a long-standing dietary habit. It's exactly the same guidelines as how to prevent heart attacks. It's the same as with the brain. Eat a better diet, keep your weight down, maintain your blood pressure, maintain your lifestyle, maintain your mind, keep your stress levels down. It's all cliche. Everyone sort of knows about it, but that's the best way to prevent stroke. If you do have high blood pressure, then to prevent stroke is to go to your primary care doctor, to your cardiologist, and find a way to control the blood pressure. If you do have high lipids or dyslipidemia, you'll need, again, medications, the correct anti-lipid medications to bring your cholesterol down. Yeah, there are medications to help prevent that, but ultimately it's preventative lifestyle choices are the main way to prevent stroke. I'm proud of the team here. I just wanted to mention that Palmdale have a great primary stroke team. I feel privileged to be able to be part of that program. We have a big future ahead of us. The community needs it, and I'm just happy to be here.